Welcome back. forpay.org health insurance segment. Folks, this is from a non-profit foremost organization. This is Consumers Dr. Bengala. Let's talk about health insurance. What is this whole idea about Affordable Care Act, how it works? Because the insurance premiums kept going up and up. I understand we had a problem there. We had 27 million uninsured. What it started as uninsured to cover the uninsured, that's how the Obamacare got kicked in, and they wanted to make sure people can afford the health insurance. That was a brilliant concept, folks. Don't take me wrong. I'm not being political here. I don't want to be political. This is something which we all need to think about seriously. When it comes to health insurance, we have to have freedom. If there's no freedom in healthcare, then let's go back to so-called socialized medicine, Canada or Britain. They have a two-tier system, folks. Believe it or not, a lot of people don't even talk about two-tier system. Believe me, I come from India. We have a British system, two tiers, public and private. People who have the money, they can get the best care. People who don't have the money, they don't get the same care. Folks, this is what Americans will never embrace it. I'm telling you, Americans will never embrace two-tier system. We want freedom for everyone, irrespective of economic, physical status. So when they talk about health insurance premiums, so-called, what is that? Bronze, silver, and gold. This is a standard now, folks. Bronze, silver, gold, platinum. Do you guys like this? I hate this, man. I hate when people try to put me in lumped together with the. Obviously, people were going to take a bronze plan. Why would they go for? But the fact of the matter is, what they say, there's a big jargon on the healthcare industry, folks. Bronze is 60% actuarial value. Silver, 70% actuarial value. Then gold is 80% actuarial value. Platinum is the best, folks, 90% actuarial value. That's what the health industry experts, that's what they're saying, actuarial value. Whatever the money you're putting in, if you're in platinum, 90% supposed to be going to the actuarial, to the healthcare costs, and 10% is for the whatever the administrative costs. So that's why your premiums are a lot higher. But people can't afford platinum. People can't afford gold. People can't afford, even silver. So a lot of people take a bronze plan. I can bet you this is what it is. The human behavior is such, they would take the bronze plan. Then why do we have in the first place? To create a class system? That's what the insurance industry has done, create a class system among the Americans. I just don't like it, folks. I don't like this. Why can't they adapt? If they want to adapt really seriously, they should adapt the health savings into their plan, and they should segment. Two things I would love to see health insurance industry they adapt. One is segmentation into well category, at-risk category, catastrophe, or chronic illness category, and catastrophic. They need to segment it, folks. They don't want to hear about insurance industry. Don't want to hear about segmentation, because you know why? Because they don't make money. That's what I don't know why. They can still make money, but they need to adapt to a risk segmentation. Actuarials. This is recommended by an actuarial for Ron Bachman for 50 years. Segmentation helps you, and it saves money for you. So you can put money aside into the health savings accounts, folks. This is where the triple tax benefit is. Health savings, the contributions are tax deductible, withdrawals are tax deductible, and so-called appreciation is tax deductible. So-called if you tied it to an index fund, it appreciates, folks. You know, it may be $10 a day or $300 a month. You're talking about, and $3,600 a year for an individual, and for a family, it's $20 a day, $600 to $700 a month. It comes to around $7,000 to $8,000 a year. Over a period of 10, 20 years, you will have 100, 200,000 in their accounts. They can use those funds for the healthcare. Believe me, when you have funds in your health savings account, watch out, consumers. Watch out. Consumers will take charge. And we as healthcare providers, hospitals are at the mercy of the consumer. That's what we need, folks. Consumer-driven healthcare. That's what I've been talking about. Consumer-driven healthcare. This is where consumers will lower the cost, not insurance, insurance industry, not healthcare providers, not facilities. You need to empower the consumer. This is what I've been talking about, folks. Let's focus on the consumer. Let's see what happens. Like any other industry, you won't have Amazon without a consumer. You won't have Google or YouTube without a consumer, folks. Consumers are a critical element of healthcare. And you need to personalize each individual, not come up with a mumbo jumbo for, don't base on the premiums. The Obamacare is based on the premiums. Don't go by that. Give the empowerment. The healthcare is all about control, folks. If you really notice, it's all about control. They're not doing any favor to you. They don't want to empower you. That's the bottom line, folks. If you're empowered, you know what the beauty about is? Technology. Technology will empower you, no matter what the Washington does. Technology will empower you. And from the behalf of forpayor.org, I would love to be a disruptor in the insurance industry. I want to be a disruptor. This is my goal, folks. Disruptor like what we have seen in the other sectors in real estate and banking. I want to be in the healthcare disruptor. That's my goal, folks. Thank you for listening. If you like this, subscribe, share, and see me in the next segment, folks. And make some comments. Love you guys. Goodbye.